Welcome back to the Morning Blend with our continuing series, Insurance 101. Most Medicare supplement plans make their rate increases during the first financial quarter of the year.
And that's why it's important to shop around for coverage. Jerry Wilson is an independent agent with Sovereign Select, where they help you do that shopping and they save you money. That's the goal, right, Jerry?
That's the goal.
That is the goal.
And you know, I didn't know, but it's vacation week. So a lot of people, you know, your previous guests, you know, Kim and I were sitting there talking and says, boy, how am I going to tie in Medicare and vacation week?
Yeah.
And I said, oh, Medicare savings equals vacation.
There you go.
It's very true. You save some money, you got some place to go with it.
That's right. That's right.
True. So this is the time of year, and it's a good time of year to shop around, right? Because I think a lot of people think about that open period having just ended.
Right. The annual enrollment period just ended.
Yeah.
So now it's a time where it's beginning of the year, and a lot of times people have different plans that they haven't looked at. And we often advise our clients to take a look at their plan, you know, every 3 to 5 years. People should be looking at their plans because there's a huge savings there. I worked with a client recently, and one of the things that we discovered is that now this may pay for a vacation, Molly.
Okay.
Because she saved $3,600
A year?
a year.
No way.
And she's been on the same plan for like 19 years.
Well, I was gonna
since
say.
retirement.
Wow.
And I know that's one of the questions, you know, one of the things we want to talk about as well, but I found it fascinating.
She's probably kicking herself for not looking sooner.
Well, you know, this is the thing, and I know it's kind of hard for us to kind of break some of our habits. We say every 3 to 5 years, but her daughter contacted me and said, hey, can you just look at my mom's plan? And I started digging into it, and I says, well, you know, based on her health, we do an analysis. We sit down, listen to the customer, see what what they're thinking. And we were able to discover that she wasn't hospitalized enough. She's in good health.
Yeah.
And she took one medication.
Wow.
And she's going to make a huge savings on her, you know, her monthly payment that she's going to make for her Medicare plan.
She's going to go on a really good vacation.
Really good cruise
really
right
good
now.
cruise.
Really good
Absolutely.
cruise. So that's my tip. If you want to take a
She
good
should bring the
vacation,
daughter.
Yeah, she probably will.
Yes,
but
she
you
should.
want to take a look at your plan and just see, hey, are there any savings there? You know, it's tax time. You know, a lot of things are happening. You should just review your insurance overall.
Well, and one of the things you say, and I think this is really worth repeating and saying, it's in your information, is it is important to be proactive in reviewing your Medicare supplement coverage because your benefits and coverage do not change from company to company, which I didn't realize.
Absolutely.
All that will happen though is that your premium will go down drastically if you
The
take a
dollars.
good look and possibly make a change.
Absolutely. Now that $3,600 savings, that's not typical.
Yeah. Right.
But normally a typical savings is around $600. But you should take a look at your plan and just see, hey, are there any ways that I can save, you know, some dollars here? With so many things going up in gasoline and, you know, insurance for other things going up, it's a great way to be able to save some dollars. And this is a great thing, Molly, you point out a great point. You can have the same coverage, you know, with a different carrier. It's just simply just finding the right one that's right for you. And that's what Sovereign Select does. You know, we take and look at your overall situation and we customize a plan that's unique or that fits your situation. You know, it's where we sit down, we listen, we have a conversation, and then we kind of develop a plan from there. And the neat part about that is that at the end of the day, you're leaving, and sometimes you may stay where you're at, but in a lot of cases, we can save people money.
Yeah.
And that's the key.
And you say another way to save money is for a married couple to potentially be on the same plan.
Absolutely, absolutely. You know, normally, you know, generally, there are some cases where families can, a husband and wife, if they get on the same plan, they can save up to 12%. It's called a household discount. So if, you know, let's say the wife retired first and, you know, then the husband retires later, they may have taken two different plans. And now it's a great opportunity for them to sit down in 2020 and kind of combine those plans and get a household savings. So that's really huge.
Smart.
That's really huge.
Yeah, and people are turning 65 every month. So if you're approaching that age, you're looking ahead and thinking about it, it's great to reach out to you guys. Have a meeting, make a plan, kind of start talking about it. The other thing is reviewing that plan and not waiting, letting those years slip by. Why?
You know, we're advocating in 2020 that people be proactive in their health insurance and their Medicare Advantage plan. When you're turning 65, you got a couple of different options. You can stay, you know, your employer will normally offer insurance. You can maybe stay on that plan and accept that retiree plan. Or you may be in a situation where turning 65, they may you may be rolled off of their plan and onto a Medicare plan. That's where you really want to step in and be proactive and really look at those various options that are available so that we're not looking 19 years down the road and you're saying, hey, I could have been saving that money all along. I could have had a great vacation by now.
Every year.
You know, every year you could have had use my Medicare to plan for my vacations.
Yes.
You know, something great there. But the last thing that I really want to share is that, you know, we do all this at Sovereign Select. And we love what we do. We love meeting clients. We love talking to your Morning Blend, audience. But we want to say that, sometimes people say, well, what's it going to cost me? Mm-hmm. And we always say, nothing.
Yeah, it's free.
It's free. It's a free, no obligation consultation. You may want to use our services. You may not. Hopefully, you as you're approaching Medicare, you're turning 65. I think it's a statistic that says there are about 10,000 people a day are retiring. So you want to be in a good position where you're looking at your plan, you're saving money, and you're talking to a professional. That would be me.
Yep.
That you're talking to about your Medicare. So, and how to plan it out. And so I think it's a great time. 2020 is a great time to really look at that and have a good kickoff to the year.
I like
True.
it.
And you do these great Road to Medicare. These are informational only, but it's a great first step in learning more about it. Look at you. Is that you on the motorcycle
That
there?
is me.
Oh,
You know what?
Jerry.
We
Come on,
thought
Jerry.
we'd change it up. We got Jerry on the Harley.
Jerry will come to you on his Harley.
On
if
the
you need.
Harley,
But
it's
this one, you got to come to him. It's in Brookfield. It's on the 13th. Actually, yeah, Thursday. And that's at 10 a.m. So that's how you do that, right in Brookfield.
Yes.
But please reserve your spot. Here's how you can do that. Contact Jerry. Oh, I wanted him to be on that one too. Darn it. Jerry Wilson, here's how you do it. No cost to meet with him. 262-222-2872 or selectjerry.com. He'll come to you, or you can come to him, or you can meet at a coffee shop. Whatever works best.
Whatever
He'll
works
do
best.
it.
Great to
Rev up
see
that
you.
Harley.
Great.
You look good on a bike.
Hey, you know what? Now I got to go sell some more Medicare so I can afford the payments.
There you go.
Exactly.
I like it.
Looks good,
All right.
though. I like
Thank you
it.
so much.
Hey, thank you so
Appreciate it.
much.
Good to
Good
see you
seeing
so
y'all
much.
again. Thanks for
Always.
having us.
Good seeing
All
you
right,
too.
have a great day.